Our timeline is a beautiful Saturday to be alive. We thank God for His mercies over our lives, and we thank God for good health. Yes, as usual, we're here today again to bring you something exciting and something that we could all relate with, especially when it comes to our heart and our food. So, what goes into your mouth and how it affects how your heart pumps. Today is special because we're partnering with Lagos Executive Cardiology Center in Lekki, where Dr. Ali is the chief consultant cardiologist. And we have their clinical dietitian, Mr. I'm
Yeah.
sorry, let me say Hunuigbe. That is easier. Yes, where they're going to be telling us some of those things that some of them we know, some of them we're not practicing, some of them we're just going to hear for the first time. Yes, as usual, this is wellness way of ensuring that the lives of people around us are well taken care of. At wellness, it's all about the total well-being of the people, and that's what we advocate for, and that's why we do this webinar every second Saturday of the month to make sure that the people around us are healthy and we can take care of ourselves the more. So I'm not going to waste our time. I know it's Saturday and there's a lot. Last month that was fasting, so that when the Paris were not so much, but there are lots of, even me, I have some more I'm going to attend to this. I'm not going to waste so much time. Um, we will not waste so much time. So let's get started. Dr. Ali, so why did you choose to master in the matters of the heart? Why did you choose
Uh,
cardiology out of all the different parts of medicine? Why did you choose cardiology?
oh, that's a very nice question. I developed that interest when I was in school, as far back even as my primary school days.
Wow.
But of course, by the time I now got into the medical school, the University of Ibadan, I had a very fantastic cardiologist. I mean, we had all those former our forerunners of medicine in Nigeria, the likes of Professor Falashe and the rest of them. And they made cardiology so interesting. And of course, I come across cases of heart conditions that are really, really touching. And from there, I wanted to be of assistance. Because quite a number of these conditions, especially when it comes to rheumatic heart disease, there are things that could have been prevented, but unfortunately, because of the way we are developing countries, so many things we don't do right, and we have cultures that are even against us, and therefore, if we can come together and outline, help people in terms of the way we live, the way we eat, the way we do all our things, and the way we listen, and the way we even commit ourselves. That's action backed up. You
Mm.
know, it will help a lot of us, especially our hearts, in protecting the heart. The heart is one of the muscular organs that start functioning when a woman is pregnant. You are told, congratulations, madam. When the scan sonologist we do the scan and say congratulations at 3 weeks, and the sonologist is able to see the heart beating, and then that is when the sonologist say, congratulations, madam. You are expected to have your delivery so date, expected date of delivery, because the heart is already pumping. So that is the beginning of life, the heart, and so we need to keep it in good shape. This is a muscular organ that continues to pump from third week of intrauterine existence,
Hmm.
and it continues in that manner until it stops.
Onto the
And when it
last
stops,
breath.
yes, until the last breath. When it stops, that is when there is no more existence of life. So we need to keep it in good shape. We need to constantly be aware that we are humans, and what keeps us going is the heart.
Hmm.
Once it stops, nothing else can be done. Somebody
Wow.
can be doing brain dead and they will say it's still alive. Yes. We just say brain dead, vegetable states, stage 3 over something. But the heart is still pumping. They will not switch off the machine. The machine will never, unless it is agreed with the relations that, okay, let the machine be switched off. And then it is when the heart stops finally that they will say the patient or the individual is no more. So it's an important organ. And we need to keep, putting it in our conscious state every second, every minute, every hour, every day, every week, every month, every year of life, that this heart has to keep functioning. It has to be in good shape so that it could we could fulfill destinies.
So when we're wishing ourselves happy birthday now, we should be able to say, thank God my heart is still pumping.
Exactly.
That's the only reason I can celebrate another birthday. That my
That is the
heart
only
is
reason, I'm afraid. That is the only reason. Because the heart, that muscular organ is still
still
active,
pumping.
still,
Okay,
still.
so you keep emphasizing on muscular organ.
Yes,
Yes, so that means the heart has a lot of muscles in it, and
definitely.
you also are specific about the fact that there are some cultural things that are not allowing us to keep our hearts in good shape. Can you mention some of those cultural um, bias or cultural inclination that is not allowing individuals to pay attention to their hearts?
The likes of, okay, you must be fat, or rather, you must have weight to be seen to be healthy. You understand? That is when a woman or a man has weight, then you know that you have arrived. Such is not the case again.
Because when a man marries a woman and she's pelenge all her life, it looks as if he's not taking care of the woman. But I know that a lot of those
Unfortunately,
are changing that now.
unfortunately, that is not the case. It's not. It's the myth. It's not the truth. You
Okay,
understand? So that is one cultural belief.
okay.
And then we have other beliefs like you must you must uh, you must drink some things, or you must, like for example, now when a woman delivers, they will say that she must drink potash, some form of, high content, to help her to remove the blood from the uterus. All those kind of things. Potash contains a lot of high sodium, and by the time you drink it, then you're adding a lot of weight onto the heart. So many. There are quite a number of them. I may not be able to mention them, but these are all. There's just few examples, and then the fact that, okay, even in our stressful life, like in Africa, for example, when you say you are going on holiday, you say, he or she has money, that's why he's going on holiday. But actually, holidays and resting from it all is one way of keeping your heart in order. That is, people should take a definite holiday. A definite holiday is not the one you attend Owambe as a holiday, or you go and you understand, going from one stressful level to preparing Owambe.
How about the
It's not a
shopping people
holiday.
do when they go on holiday instead of sitting down in one place?
I'm telling you, instead of resting, sitting down in one place, all those things is not a holiday. Holiday is the place where you have fun, you just sit down, you relax, you just shut it off, and your heart is at peace, even within yourself. That is the kind of thing. Holiday is not saying you are on a break, holiday from your normal work, and then you go and take another job duty somewhere, and then saying you are in holiday. So these are all the a white man will never joke with his or her holiday. You will see them working, saving towards a holiday, and they will change even location to make sure that they are not disturbed by any form of work. Work will continue for life. Work is for life, but human being has a time limit.
Yoruba
Human
people
being
will
has a
always say, Emi Shegun. So we should take some time
Segun.
out to rest. And rest is not
Exactly.
we don't have to think about the monetary value alone. You could leave
No,
Lagos
no,
to
no.
a state and go and rest and
Yeah.
enjoy the freshness of the air and calm down. Thank you, ma'am.
Exactly,
Thank
exactly.
you,
Those are
ma'am.
all the little things, but they add a lot into our well-being.
Okay.
They may look Very little, but they had a lot to our
Yeah,
help.
those are the cultural barriers that we need to.
Yes, and of course, coming to the food that we eat, definitely they are also part of it. Some people believe that when they have not eaten swallow, they have not eaten. In fact, they believe that rice is snacking, swallow is food, and all these kind of day-to-day beliefs, unless they eat swallow, they don't believe they have eaten. And people have this habit of taking swallow every day of the week. And even when they eat rice, they must still take swallow. Is that not a lot of calories? That's a lot of calories. So all these myths and beliefs that's coming even to our diet as a main theme of the discussion today, they just have to go away. We need to replace them with healthy, heart-friendly, heart-friendly practices.
So
That's
our nutrition is going to help us with the kind of food we're going to be eating. Please don't forget to share this link with friends and family, because we've just talked about some cultural bias that is not allowing us to keep our hearts in shape, because our heart is a muscular organ, and Dr. Ali said it starts beating from the third week while the baby is still not yet fully formed. That is wonderful, and it stops when you take the last breath. So the most important thing is we need to keep it beating, and we need to keep it beating while it's still in good shape. So we're going to be asking other questions. What are the signs of high blood pressure? What are the signs? What are the signs people should look out for? We had a webinar in I think in February about this, and the doctor also said that at the point that you are already diagnosed of hypertension, then the damage has started. So what are the signs that people should look out for so that if they are the pre, they can always come, try to change it for
okay. Thank you
hypertension.
very much, Miss Moderator. High blood pressure has no sign. There is no symptom. It's a symptomless condition. And that is why by the time the individual develops symptoms and signs, then it means that it has been there for nothing less than 5, even sometimes 10 years.
Wow.
Yes. By the time the individual develops signs, if we are waiting for signs of high blood pressure and symptoms of high blood pressure, then it means that the condition has been there for nothing less than 5 good years. And during that 5 years is when we should be doing what we need to do. And that is why we are here today. And during that 5 years, or the preceding years when before the signs we developed, is that you might just be feeling that the usual way that you used to do, you don't, even lack of sleep. If you are the type that sleeps soundly before, and you begin to notice that, you are so restless when sleeping, you wake up, from time to time, then you begin to think, what is happening to my system? It might be some pointers. So I will call them pointers. What are the pointers? That is telling you and I that we need to begin to do some evaluation of our health, the health status. If you begin to having sleepless nights, then, or you begin to find out that when you climb the usual regular staircase, you are a bit unduly draggy or tired more than usual, or you begin to have, there are times you never experience any form of headaches, but you find out that you wake up with a nagging headache. Why? Why should I wake up with a nagging headache after a very nice, good sleep? Then it means that you begin to look for what is wrong with my system. Is there something wrong? Normally, after a good sleep, you should be up and about,
Yeah.
eyes clear, energy, like strength coming into you to face the day. But if you find out that you begin to have a headache, you are draggy, you can't pinpoint it, then it's a time to begin to check. So checking is part of it, is the beginning of it all. Check these numbers. That is, check your numbers. There was a slogan about 3 years back, World Heart Federation Day and World Hypertension Day. The thing is, check the numbers, your blood pressure numbers, your weight, your BMI, your weight, your height, your waist circumference, whatever you need to check, your blood sugar, your cholesterol, go and check. Don't wait for signs and symptoms.
Thank you, Dr. Hali. So we're going to do the check your numbers campaign again, because I think a lot of people are checking the numbers in their bank account most of the time. They are checking the numbers that has to do with their vital organs. So I think we're going to start that campaign again. Check your numbers. People have to
Yeah.
check their numbers. People have to, whether you are feeling tired or not, just check your BP from time to time.
Yes.
Your blood sugar from time, because as we grow older, we're not the same person. The body also goes through wear and tear. Of course, God has made it possible for the body to repair and repair and repair
Yes.
itself,
Yes.
but it should, in
Yes.
case the repair is not totally done, that's one of the reasons why we need to check our numbers. Thank you for that information.
You're welcome.
So there might not be signs, but
Yeah,
if
man.
everybody makes up their mind to check their numbers as often as they can, it is easier for you to isolate some unusual things. Then we need to pay attention to our bodies. The body does not deceive us most times. It tells us once in a while. So how often should an hypertensive patient visit his doctor, say cardiologist? How often? How often should they visit the hospital?
Okay. Okay, that's a very nice question. In the fact that I will answer it in two ways. It is there's all this there's also this erroneous belief that I am young. I don't need to see a doctor. You are
Is
young.
there?
As young as what age? And the individual will say, but I'm 20 years old now. I used to see my father and my grandpa going to the hospital. What do I go to the hospital for at the age of 20, at the age of 18, or at the age of 15? So we need to debunk that belief as well. That as you grow older, the adult age starts from the age of 12. Some countries say 18, maybe, but in the health industry, in the internal medicine, we take 12 as adult age, 12 years old. So as from that age, you should begin to check. Yes.
Wow.
So parents, therefore, a lot is now falling on the parents at this point in time. For example, if a mother and a father discover that they have high blood pressure, both of them, it means that their children, they will need to begin to take special, everything in their consciousness that, I need to look after this, my daughter or my son. You look at how big you are, son. You need to do something. Let me take you to the doctor. Let's even know what your BMI is. Let's know what your blood pressure is. Because having the background that the mother and the father are on treatment for elevated blood pressure, or maybe even their grandparents or uncles and aunties have even had sudden cardiac death from elevated blood pressure or from diabetes. So a lot now falls back again on the parents, because the 12-year-old might not easily say that I want to go to the hospital, but it's their parents that will say, okay, my children, oh yeah, come, go and have a checkup. So checkup for children age 12 and up is mandatory. It might be done once in a year, you might do it once in 2 years, but it is mandatory because it is not known. Before, high blood pressure used to be related to 40 years, around the years of 40, age of 40. But now we've seen a shift, and the shift is towards a much younger age group, 20s, 18, undergraduates. I've heard the story of two young men who died preparing for their exam in their undergraduate years. They are preparing for their final exams to have their certificates after 3 or 4 years of rigorous, university. They are not, vying for their last exams to come out of the university, but they just slumped and died. Brothers, same parent, and their father has very severe high blood pressure. I never took care of their mother. Somebody will say maybe it's one witch in the family that is witching them. It's not true. There is no witch anywhere. And these children die at the age of 21, 22.
Wow, this is scary.
Very scary.
Parents
But I
on a
think,
timeline. You are
yeah.
hypertensive and you
So,
have any. This is the time to pay attention to the children. I think that we shouldn't take it for granted that they are still children now. Dr. Ali has said that the adult age for in medicine is 12 years old. So if we have any disease, if we are managing any illness and we know that it could be hereditary because hypertension, some people are predisposed to it through birth and through hereditary. I think we need to pay attention. We shouldn't take it for granted that they are still young. Wow. So you've not asked the question, how often should they visit the
so
hospital?
how often should they be checking? Now, if you have been diagnosed to have high blood pressure, your physician, your GP will be able to evaluate you and know how often the person will be coming to the hospital. For example, sometimes it can even be once every 2 weeks, depending on the presentation
It's
or
severity.
how the patient is. So sometimes it's once a month, sometimes it's once in 3 months, sometimes it's once in 6 months, like twice a year. So depending on the individual cases, the physician will be able to say, okay, please come and visit, come for your follow-up visit at this particular time. But one thing is very important: all these chronic illnesses, there is a lot the individual is going to do. Your own individual home measure is topmost.
Hmm.
That is, by the meter, if it is high blood sugar, by the glucometer. If it is high blood pressure, by the Omron blood pressure meter, so that you can self-check yourself at home. And have some of them has a memory they store there. You can, so that you can bring it during that 1 month follow-up visit, and be able, then the physician will be able to see, okay, while I'm not there,
This
what
is
has been your blood pressure, because every day counts.
hmm.
Not not that once in 3 months counts. The one that counts is the one that you do yourself at home,
Hmm.
because it means your organ on a day-to-day, minute by minute, second by second, hour per hour, day by day, week by week, is on that stress of blood pressure. If it is not well controlled, and if it is well controlled, it means that your heart is very happy. You are working at peace with your heart. So home check care is very important. Then when you bring down your records to the physician at that follow-up visit, then the physician will tell you, congratulations sir, congratulations ma'am, you are doing perfectly well. Oh, your blood pressure has been out of range. You need to do something about it now. We need to do something about it. Then we can begin to talk about your diet. Okay, what have you been eating? What state level have you been on? And then make adjustment. You know, and even the follow-up visits might have to be shifted forward, backwards, depending on your home care, your own, meters. So that is very important, and that is why in cardiology now we are developing. There is the World Heart Federation is developing what we call artificial intelligence, digitalize. They want to digitalize cardiology such that your doctor can see you, while you are anywhere in the world. Your doctor can see your heart, the way it's doing, your blood vessels, the way they are doing, through your blood pressure reading, through your, so where that is what the heart, because this is an enormous burden of condition. Hypertension is enormous. People are
Okay, I think that's the internet.
The network has come. Okay, she's coming back on.
Is that
Yeah, she's back.
we lost you
okay.
for
Can
some
you hear me
time?
now?
Yes, we can hear you, ma'am.
We can hear you. Okay, so viewers, one of the things that is instructional from Dr. Ali today is the fact that no matter, it's not about the time you visit it's not how often you visit your doctor that is important. It's what you do while your doctor is not there. what you do per second, per hour, per minute, per day, per week, those are more important than just going to see the doctor. So it's good to keep your appointment with your doctors. But what are you doing every day to ensure that when you go see your doctor, it's going to feel good that you're helping him get a good result or helping her get a good result. So what you do without your doctor while you're in your homes are very important. And we've also known that everybody needs to go for medical checkup. Everybody, for as long as the child is about 12 years old, and if you know that you have predisposition or you are already diagnosed of any chronic illnesses, it's good to start paying attention to our children. Yes, they are young, but now I don't know what is shifting it. I don't know whether it's the end of times. That's why a 21-year-old could have terrible heart diseases. But when the causes of things are unknown, it's a lot of issues. But we can actually make some things known by doing proper medical checkup. So I'll ask Dr. Nugbe, Mr. Nugbe, our nutritionist, a question now. So keep talking about food. And somebody had already said the rice we eat in Nigeria, whether it's part of the things that is costing, because a lot of people just eat rice every day. Like for me, after listening to so many people talk about rice and all that, I've reduced my consumption of rice, as in I don't take rice more than once in a week. But what are the food that we should really look out for? I know that one has to be very creative to give to eat well, and to eat well one has to be very creative. And a lot of times most of us don't have the time as well, so it's just what occurs to you that you just cook. Can you help people on this timeline as a nutritionist? What would you advise, the kind of meals that we have to eat that will keep our hearts in shape?
Okay, thank you very much. My name is Miracle. I'm a clinical dietitian. I'm standing in for dietitian Ogon. So about diet and hypertension, right? It's a direct thing. It's a very direct thing. Unlike diabetes, that's not really directly related to um, diet. But diet and hypertension are actually very directly related. How? The amount of sodium you consume in a day determines how much blood pressure you are going to be, or how your blood pressure is going to be. Because one very important thing we need to know about sodium is that sodium has the ability to retain fluid, right? It has the ability to retain fluid. That is one of its major jobs, one of its functions. It has the ability to retain fluid. But a good thing there is if there can be a balance between your sodium intake and your potassium intake, that's the great thing, right? If you can know how to balance your sodium intake and your potassium intake. So the ratio is supposed to be about 1 to 3. Yeah, sodium is supposed to be 1, potassium is supposed to be 3. So coming down to the question of whether people should eat rice too much or whether they should eat swallow too much, well, that's not the actual problem, because I'm very sure our grandmothers, our mothers those days in the village actually did eat rice, they ate fufu and
And they
all,
swallow
but they
every
were
day.
active. Yeah, they were active, right? They are not always behind the system too far, and they're not always nibbling and snacking on junks and all. They are active. You can see a 60, 70-year-old woman walking from her house down to the farm, right? She's helping her heart to work better. And she's still eating the same food, the same rice, and all. Because, like you said, thank what you already said. You said something about you have to be very creative if you want to eat healthy. And it's true. We Nigerians, we actually know we don't have fruits. We have rice, we have beans, we have what they get, swallow, and that's it, yam, potatoes, and all. So the major thing is if you can know how to curtail the amount of sodium that comes into your diet. And the major culprit here is salt, right? Normal table salt. But the thing is that you don't really need to take out table salt from your diet totally, because there's a limit you have to go with it, right? The normal limit to take for salt in a day normally is about 2,500 milligram. That's 1 teaspoon of salt. Then if it's very severe, because probably the person's hypertension is very severe, then you can reduce to like 1,500. That is two over three of a teaspoon of salt, right? That's it. So, and what we also should know about this is that every food, I mean every food contains an amount of sodium. Why? Because what I said before, sodium helps to retain fluid, it helps to retain water. So the way it is, the way nature has made it is that every food contains an amount of sodium so that it could help to retain water in that food and help to retain its shelf life. Right? That's how nature made it. So if you are eating bread, you are taking an amount of sodium. If you are eating any fruit, you're taking an amount of sodium. So whatever it is you want to eat, you're still taking an amount of sodium. So you cannot really say you want to cut out rice, you want to cut out swallow because you want to reduce your sodium. What you have to do is look at the amount of other foods that might be higher in sodium, because sometimes sodium doesn't just come as sodium. Sometimes it comes as sodium bicarbonate, right? If you check biscuits, if you check gala, and all these things, you see sodium bicarbonate there. Sometimes you can actually see like monosodium glutamate, that's the MSG. So those are the things you need to also be checking out. Since you now know that every food, virtually every food contains an amount of sodium here. So those other small biscuits, small chin, small fried plantain, yeah, all those other side foods. Like most people will just get on their work table. Once you pull out their work table, you see chocolate, you see granola, you see this, and they are already sitting on their table doing nothing. They are not exercising at all, and they're always living on those things, right? With all those things, you don't even know the amount of salt you've actually taken in a day. That's one of the problem. And another way to help also is to balance the potassium sodium ratio, right? Your potassium intake has to be higher. And foods that are actually rich in potassium, potatoes is actually very high in potassium. Both Irish and sweet potatoes. Another one is bananas. Bananas contain a reasonable amount of potassium. Then another one is avocado. Yes, avocado actually has a good amount of potassium. What potassium does in the body, especially for those ones with high blood pressure or for people without high blood pressure, is that it helps to easily secrete excess sodium through the urine. That's what it does. It helps to secrete excess sodium. So if there can be a balance between your sodium intake and potassium intake, then you can actually just eat them. There's really no heavy restrictions for hypertensive patients, especially when it comes to food. We just need to calculate the amount of sodium it takes. So sometimes you might be seeing somebody, my dietitian might be telling you, take a pinch of salt with a quarter cube of any bouillon cube. Don't do this, don't do that. Then they can now start asking you to add other alternate spices. There are other alternate spices that have been proven research that could help in the management of hypertension also. So that's the best way to go about it. Reduce your salt intake, reduce your bouillon cubes intake, make sure there's enough potassium in your diet. Then look for alternate spices. Alternate spices like oregano, alternate spices like garlic, like ginger, like cinnamon, like cumin. All those alternate spices would help, and they have actually been proven to help manage that hypertension. Sorry.
Thank you, Miracle. Thank you. This is a very good one. So you're not giving us any restriction on the kind of food that we can take. We can take any food, but we should be mindful of the amount of sodium in what we take. And every food we take, every fruit, everything has sodium, has an amount of sodium really, or most of the things we take has an amount of sodium. So we shouldn't just be focusing on the salt we put directly in our meals. We should focus on the fact that every other thing that we've eaten also has some amount of sodium, and so we
Yeah.
have to be careful about the sodium because it allows them, it causes water retention. And we need to also balance our sodium intake with potassium intake. And you've also told us that some meals that potato, banana, avocado, and some other meals we can research that helps, that has a lot of potassium. So meaning that we can eat as much as we can eat. Of course, everybody already knows that you can't take anything in excess. But one of the most important thing is we must balance what we eat. We must be creative when we shouldn't just eat to fill the tummy. We should eat to stay alive. So let's eat to stay alive. Please share this on your time. I share this webinar as you're listening. The dietitian wants us to eat to stay alive, and in eating to stay alive, that means we have to be creative. We have to choose what we're eating. We need to make up our mind that we need to reduce some things, and we need to ensure that we take some things. He's not giving us any restriction. He said we can eat whatever we want to eat, but make sure that your sodium intake is very, very low so that you are not exposing yourself to more danger. Thank you very much. For individuals, Dr. Ali, for individuals that their relatives are already hypertensive, what extra measures can they take to completely minimize the risk of becoming hypertensive? What extra you already said that people should do medical checkup and all that, but once you know and for parents that are already hypertensive, what measures should they start taking now for their children, apart from checkup, apart from knowing the numbers of those children? What other things should they do to make sure that they stop the history?
Thank you very much, Ms. Moderator. Well, when it comes to hypertension, there are two major things that we always, itemize, and one of them is the hereditary part that we have mentioned, which cannot be changed. That is what we call non-modifiable. But we have a lot of what we call modifiable risk factors for high blood pressure. I hope everyone is hearing me.
Yes,
Uh,
yes.
and that is and that is really the one that we should, and we are talking about today. We call them modifiable risk factors in developing hypertension or what in the prevention of high blood pressure. So, and of course, the lot of it, as the dietitian has said, is a diet. And worldwide, there is what we call dietary approaches to stop hypertension, which is called DASH diet. You must be conscious of it. That's what we call dietary approaches to stop hypertension must be part of, if it is being practiced in the UK, it is being practiced in the US, then it must be practiced in Africa. Because these are well researched, and volume of data have come out and say that this is it. If we don't practice it, what do we have our own? Do we have our own? Ask me now. Do we have our own?
We don't have anything, we have
We
God.
have our own. But if we don't have our own, then we need to stick to the international standards. Short of that, we're in it for trouble. And that is why the WHO says that about, in fact, some ridiculous figures, 265 million and over, or maybe 360 million Africans will develop hypertension by the year 2030. And they said that out of these so many millions, majority of them, the morbidity and the mortality they quoted another millions of figures in Africa. So, and we don't have our own data. We don't have anything. And year 2030 is around the corner. This is year 2022. Ask me now. So we need to join them. Dietary approaches to stop hypertension. Yes, our food is good. I will say that. Our food is good. But the calorie content. The calorie content. Yes, the dietitian has mentioned the salt. Every food has their own, even natural salt. Purpose of adding salt on it, which must be stopped. But then the calorie counts. The calorie counts. And this calorie counts because these food items, there is what we call inflammatory food items, anti-inflammatory food items. The diseases, the genesis of diseases, the pathophysiology of all diseases, whether hypertension, diabetes, cancer, asthma, all of them, is what we call inflammation.
Yes.
We must bear it in our conscious mind. If Africa will not fall into that 360 million or billion, whatever WHO has quoted for Africa to have developed hypertension. So we must fall in line. Yes, our food is good, I can say that. But we must be very conscious of which is pro-inflammatory and which is anti-inflammatory. And therefore, our calorie or whatever we put in the table on our table to eat must simulate that thing that, okay, I want to eat less of inflammatory food and lots of anti-inflammatory food, because they are the ones that thicken the blood vessels. They are the ones that makes the blood vessels to the brain to be thickened, atherosclerosis. Is this food? Is this same food we are talking about? It's nothing else. You are what you eat.
Hmm.
Nothing else. You are what you eat. My mother will say, okay, something is getting missing. Something is lost in the house. Am I going to go to Uju Elegba to ask for what is missing? Is it not in the house that we ask for what is missing? So therefore, it is in your house what you eat. It is in yourself what you put in to yourself that forms your blood vessels to the brain, to the heart, to the kidneys, to the legs, and to every of the organs. They are not feeding on nothing else. They are feeding on what you are feeding it. And so we must be well conscious of what we are feeding all our organs, especially the blood vessels, right from the head to the toes. It's the same blood vessels. They are just network. So now, if you look at the dietary approaches to stop hypertension, essentially what's been divided into the food quantity, the calories of the calorie that you obtain from food that are inflammatory, like cassava, yam, and so on, that has a lot of calories. Therefore, you take less of those ones. Then those that are anti-inflammatory, our vegetables in the Garden of Eden. I don't think God made amala in the by the Garden of Eden. What He made were kales, vegetables, carrots, all of them, different colors, beautiful. We were told the Garden of Eden was so beautiful because it has fruits, vegetables of different varieties. Those are the ones that we should have in large quantities. So therefore, parents, again, we are back to parents. Parents will begin to feed their young ones because charity begins from the home. Parents will begin to feed their young ones, say, with little bit of calorie of whatever amala eba or whatever you want to give them in small portions, portion control, and making sure you introduce them to vegetables, veggies, fruits, early enough. I'm not saying that they should not drink all these fruits in the cartons, so all these highly packed with sugar fruit drinks.
Fizzy drinks.
God bless fizzy drinks. You understand? As long as that I'm bringing down those companies, I'm not bringing them down. But to also say that fresh vegetables, like if you want to cook rice, for example, rice is good. If you cook your rice with cabbage, I believe all of us know what cabbage is. Somebody will be saying that it's expensive. Cabbage, there's 500 naira cabbage, there is 250. Cook your rice with cabbage. After cooking the rice, put cabbage on it. And then by the time you are taking bowl or a scoop of rice, you'll be taking scoop of what? Cabbage. Is it not to fill your stomach? You understand? So you know that as you are eating and cabbage, all these things are very sweet, are very nice. Once you introduce to the children early enough, and then somebody will say, apple is so expensive, this is very expensive, although they are seasonal, so that you can get them cheap. But at that season, do you take them when they are out? At that season, do you eat them?
Like we have lots of mangoes now.
God bless you. Introduce it to your field, and then people should have blender. I think blender is very cheap. There's 7,000 naira blender. There's 6,000 naira blender of different. You don't need to go for Russell or the Kenwood of this world. There are some little blender cheap, 5,000 down the lane. You can blend, or if you don't think you can use better motor now and blend all these fruits together to make your anti-inflammatory items. That is, as the moderators has rightly said, what do you feed your stomach with? What do you fill your stomach with? So all these things are very important. We need to be able to attach ourselves to these dietary approaches to hypertension, to stop hypertension. We must not come out of it because we don't have our own. We have to go on it. Yes, and therefore on that pyramid is lot of fruit and vegetables. Of course, the first one is exercises. Exercising. We must introduce exercises to our children right from their younger age group, so that they grow along with it. They must know that exercising is part of living healthy, and then of course the food items they are being fed with. And parents should stop sending their children to school with bottle of Coca-Cola. They put this water bottle. they will put Coke Fanta inside water bottle. Why can't you give your child, one or two slices of good bread with some veggies inside it, with slice of egg or something, just and then a bottle of water, you know. So all these things are part of a day-to-day routine that every one of us we need to. The feeding is ritual. Yes, feeding is ritual because we need to do the ritual of feeding every day. So therefore, we must feed right so that we can get good result with regards to our hearts and the blood vessels, so that the blood vessels will not become thickened with what we are feeding ourselves with. Yes, I know the salt is very important as far as because blood pressure is a product of your blood volume and your peripheral resistance. So if your blood volume is right and your peripheral resistance is high, you are still nowhere. So everything, all the equation must
Works
balance.
together. Okay.
Must work together.
Thank you very much, Dr. Ali. So, the instruction today is that you become what you eat, and the fact that when we want to choose our diet, in one of the things that could prevent that the measures that we can take to minimize the risk of hypertension, on top of it is the most important part of it is our diet. We've talked about eating less food with less salt. We've also or less sodium. We've also talked about food that has anti-inflammatory and those ones that promote inflammation. So most of the sicknesses and illnesses that people have, apart from the ones that have unknown causes, what we eat actually contributes a lot to what happens to us eventually. So we're telling us on this timeline that take lots of food that does not promote inflammation of the cells, and those foods are vegetables and fruits. So let's go green, let's go back to the Garden of Eden, like Dr. Ali says, where only fruits and vegetables were there, so that as much as we can, no matter what we're eating, let's ensure that we have fruits and vegetables. So when you want to prepare your meal and you want to be creative about it, you don't just take care of the carbohydrates and the proteins. You're asking yourself, how much vegetable am I adding to this meal, and how much fruits am I adding to this meal? I want to ask them Miracle. We have few minutes left. Please send in your questions as well. We're almost exhausting what we have. If we have questions, we can also add it to this. And also, please don't forget to share with your friends and family. This is very important to us. You can't get tired of hearing things. I learned something new today as well. You can't be tired of hearing information that has to do with your health status. So Miracle, I want you to tell me, are there herbal mix that people should take? Because you're a nutritionist, and I believe that you understand some of the concussions that people go on. I saw somebody yesterday and said she's losing weight because she takes a seed from Ghana, and I'm like, really? I said, be careful. Lo. She said when she takes the seeds, she doesn't even go out of the house for that period of time because she has. And I said, be careful. Don't damage your organs. So are there herbal mix that can reduce complication from hypertension? I need you to do
Okay.
it fast, fast, so that I can ask two other questions.
Okay, no, there are no herbal mix. Like Dr. Ali rightly said, we have to just go back to the Garden of Eden. The only herbal we need to take as the one that the vegetables and our fruits. There are no herbal mix. But actually, there are actually some seeds and nuts that could help. There are some seeds that contain monounsaturated fatty acids, right? Some seeds contain monounsaturated fatty acids. Some seeds like flaxseed, sesame seed, chia seeds actually contain monounsaturated fatty acid and also have anti-inflammatory properties. So those ones also could help with the heart health. Right? Not like you just continue eating them and your blood pressure will reduce and drastically no. But if you take them, add them to your lifestyle, because hypertension is a lifestyle kind of disease. You just need to know how to modify your lifestyle. So you can just add them to what we all discuss here. More vegetables, do the dash approach, right? More vegetables, reduce calories, then add these nuts and seed here and there. And that's above it's a concussion, a herbal concussion of you're just going to be blaming your kidneys.
Thank you, Miracle. So there is no concoction anywhere that can help you with your hypertension. The only concoction is for you to eat lots of fruits and vegetable, and it said some nuts like chia seeds, like flax seeds can also help. So no concoction anywhere. Don't buy anything from anyone. Go and mix your concoction by yourself by buying fruits and vegetable. Mix it, blend it, eat it raw, eat it in whatever
Any
form,
way of your choice.
and enjoy it. That's the only concussion that can be assured. So some people get tired. Some people get tired of taking the antihypertensives, and that's one of the reasons why we have a lot of crisis in our hands. Please, can you help us to tell people on this timeline that is hypertension does it require a permanent care or treatment, or is one off, or is off and on care?
Oh wow! Hypertension is life treatment. It's lifelong treatment. As long as you are alive, you must be seen treating it, especially when you have been known or diagnosed with a condition. It's for life. Treatment is for life. Some people may say that they stop their drug and then their blood pressure is normal. I'm sure they're still doing some modifiable risk factors, even in the management of it. But treatment is for life. The drug treatment is for life. The reason why this is so is very obvious. Even without us eating, as we grow older, our arteries tend to thicken. So there is a normal aging atherosclerosis for everybody. It's part of aging. And that is why human life is limited. You understand? So as part of aging, atherosclerosis is a continuous form. So now when the individual has hypertension or all the other chronic illnesses on top of aging, then it means that you have, the risk factors are multiplied, and therefore, you need to do something, taking your medications. And some people say that these medications they are taking, will it is it not the one that is destroying the organ? And I'm like, I will tell them, look, the benefits of taking these medications outweighs any form of risk, because it is when you don't take it that sudden death, kidney disease, stroke, or kidney failure, all kinds coming. But when you take it, you prevent stroke, you prevent kidney failure, you prevent heart attack, and you prevent have your sudden death. So it's when people do not stick to their medications that all these complications arises. So it's always important that take your medications, every day. Of course, the doses, the milligram, the grammages, all of them changes with time, but because that's the reason for the follow-up, so that we can always, okay, you need to reduce this, you have to increase this, oh, something has come up, and therefore, that's why the reason for the follow-up, visit all the time. So don't think the physicians want to take your money or something. The reasons for follow-up are very obvious. They are very important. Yeah, so that's very important.
Thank you, Dr. Ali. For everybody on this timeline, she has reiterated the fact that okay, Miracle said hypertension is a lifestyle disease, and meaning that it's only lifestyle. It's something that we have to take care of every day. So medications and the kind of food we eat will modify, or the kind of lifestyle. She also talked about exercise as one of those things that could help. So exercise, once you take care of exercise and food, and you are religious with your medication, you are not likely to have a lot of complications.
Complication.
Yes, we've also said that we shouldn't deceive ourselves and trying to take any herbal mix from anyone. You can mix your herbs for your hypertension. Just take care of fruits and vegetables, mix them together and some nuts, and that could be a very good herbal mix for you to take. So you don't really need to go and knock on doors and ask questions about herbal mix. We also, Dr. Ali also told us that the adult age for humans in medicine is 12. And so if parents have predisposition, or they're already treating one form of chronic illnesses or the other, they need to make up their minds to take care of their children and see how they can minimize or not expose them or reduce their exposure to this predispositions that they already have. And that's by doing regular checkup for our children as well. By taking care of what they eat, we need to be creative with what we eat. We need to eat food with less sodium. We need to eat food, balance our sodium intake and our potassium intake, and foods that have potassium, rich potassium. Avocado is in season now. Banana is always available. Potato is also available. We should make them a part of our diet because they are really, really good for us. We've also said that hypertension is a silent killer. It does not give signs. At the point that you're already having signs and symptoms of hypertension, you're already having you might have been developing the disease for like 5 years, and it just comes to for so one of the things that we need to do is to understand our body. And when you see that things are just not normal, you used to sleep well, now you can't sleep well. The basic exercise that you can do now, you can't do it, and some other things, you need to see the doctor. So don't just see the doctor, because she also said that when doctors give appointments and they tell you to see them at a particular interval, it's not so much about seeing the doctor that is important to a cardiologist. What you do while you're in your homes, what you eat daily, how you take care of your heart is more important to them than the results that they see on that day you present themselves. They feel good and feel better with people that daily they are taking care of their heart by making the right choices when it comes to food, it comes to exercise, and it comes to their medication. That's the only way that they feel that patients are really taking care of themselves. So the heart is the only organ that was developed for. It's one of the few organs that started that development was early in life, and every person cannot pass on until the heart stops breathing. So we need to take care of our hearts. She also said that apart from every other thing, people could have hypertension based on aging of some of the vessels in the heart, and that's why she's saying, if you see her, she's passionate about what you do outside medication, is what you do outside the doctor's room. Those are her concerns, and she wants us to do that. Wants us to do that regularly. Yes, cultural disposition. When a woman, I know someone that wants to get married, and they told her that she has to be taken care for like taken care of for 3 months to grow fat before they present her to her husband. I said, when you start having babies, you grow fat. So come and look at my picture before and after. It's always so. If you have grown all the fat now, what will happen? And she went back and told them, and I think they accepted that they should just marry her the way she was, and that was how
Exactly.
they got married. So some cultural things. And Tobayoko, Nikegbowofu, is the person that has big tummy that you should give money for. Those big tummies are not good for us now, because once your waistline is above a particular circumference, you're also predisposed to diabetes and all that. So husband is taking care of me, and you're eating so well, and you're just getting round and round. That those are not yes, they are cultural things, but they are not supported by medicine now because of what we're seeing all over the world. So we need to keep our hearts pumping, and we need to know our figures. Please, the figures of your bank account, the figures of your number of followers. Yes, on social media pages are very important, but the figures on your health status is much more important. And I can tell you, that's one of the reasons why we created the app, Wellness Plus app. You can go on that app and do your dental checkup, your dental checkup, you can do your optical checkup, you can do your cancer screening test. A lot of people, cancer still has unknown origin, but once it is identified early, then the person can be fine. You
Can
can
be
do
cured.
comprehensive medical checkup, you can do basic medical checkup. If you are bringing somebody into your home, you can do a pre-employment medical checkup for them. Go on Awareness Plus app and do that today, please. And also, don't forget to keep your appointment with your cardiologist. Dr. Ali is one of the cardiologists, a seasoned cardiologist in Nigeria right now. Don't forget to keep your appointment with them. But most importantly, make sure you are taking care of yourself before you visit her. What you do daily is more important to her than what you tell her you're doing when you come to the doctor's room. Dr. Ali, do you have anything to tell our audience?
Well, it's been a very useful morning. The slogan for by the that WHO, the World Heart Federation, WHF, the all this international body is that we need to go out there and get the information out to our people, to our community, and that is what we have rightly done this morning. I must say that people should hear and then they should take action. Hearing without action is zero. It's just making noise. But if we, as we have spoken out this morning, and we back it up, with action, the community, everybody hearing now, or that we hear our voice later, they must take action as to what has been discussed this morning. Then we will have a healthy society, and then we will have we don't have to go through the pains or people coming down with kidney failure is very bad. It's very bad. Or somebody coming down with stroke and with the debilitating problems is really bad. But all we have spoken out today is to prevent the occurrence of these preventable complications. The thing is that they are highly preventable. Somebody who has high blood pressure succumbing to hemorrhagic stroke should not be the case. It shouldn't be the case. That should not be the end point. Or coming down with kidney disease or kidney failure, it shouldn't be the end point. Because I personally have treated patients for years who are who have turned 90, 80, celebrated, octogenarian ages because they have been action packed with what we have just said. So please, these conditions should not result in death or debility. Everybody should stay alive and be well. Thank you very much. And of course, Lagos Executive Cardiovascular Center is there to check your heart, to check your blood vessels, and we give you a clean record and tell you what to do
Thank
anytime,
you
all the
very
time.
much. Miracle,
Thank you.
what would you like to tell our audience?
Okay, I would take one of the quotes that Dr. Lee made. That quote was actually what our lecturer said to us the first time we were doing diet therapy. He said, "You are what you eat." And essentially, that's just the truth about hypertension and any other disease, actually. So, what I have to tell everybody is be mindful of what you eat, right? There are so many fast food, there are so many restaurants up and down, and you want to really show that you have money and you just want to jump on any of them and take a cup of ice cream or a bowl of ice cream and do this and that. But just be mindful of what you eat, because whatever it is you take into your body determines your health status. Be mindful of what you eat. And apart from just being mindful of what you eat, it's very important that we are active, right? It's very important that we're active because most people now are doing remote jobs. So you see most people do remote jobs and they're always at home and they're not doing anything and they're still eating junks and still taking much of calories. Right? So be active, be mindful of what you eat, because the narrative now is that we shouldn't tell people they're fat. Fine, no problems, but it's actually still a risk for hypertension. Obesity is still a major risk for hypertension. So while you watch what you eat, also be sure that you are actually doing exercise. There are exercises that are actually very we are very comfortable with. There are exercises you can do and we wouldn't really strain yourself. When we say you should do exercise, we don't really mean you must hit the gym and you must carry iron and your
You
chest
can
block.
just dance. You can just
Exactly.
dance. Yes, you can
Exactly.
just
You
dance
can
and
dance,
sweat
exactly.
it.
You can dance to any song. You can just take a walk around the estate or around your compound or something. Or you can even fake skip your bathroom. So it's the lifestyle modification is actually the most important thing for hypertension. The medications are very important, like Dr. Ali said. It's a lifelong thing. So you can't just drop it today and expect your blood pressure to be normal. Right? So first, you just keep on with your medication, keep on with the lifestyle modification. It's very, very important. And you will see a very good result at the long run.
So I want to say thank you to our audience again. Thank you for being a part of this. We love you. Don't forget to subscribe to our YouTube channel. Subscribe so that you can have notifications each time we want to have webinars and what we're going to talk about at every point in time. And also, don't forget to take care of yourselves. Know your numbers beyond your social media followers and likes, beyond your account numbers, your account figure or balances, knowing your health status numbers is very important for you to be alive. And we want you to stay alive. And that's why Wellness brings this every month to you. So thank you very much. Follow us on our social media handles as well, wellness_care, and enjoy yourself. Enjoy a good, today is a very bright Saturday. If you have parties like me, enjoy yourself. And
Thank you.
be creative with your meals.
It's your meal, yes.
Yes, have a great Saturday ahead. Thank you very much.
Okay, thank you.
Thank
Thank
you.